I think it's different for everyone, the major symptoms of PMDD. I really like what I've seen from other people's video, it's on YouTube, about PMDD, that a lot of people understand that it's not just severe PMS. I described it in my video on basics, like, kind of, I mean, it kind of is to explain that it's the time before your period and that it's like this, hormonal experience. But it is so intense. It is so much more than just PMS. I mean, it takes over your life and you're just like dysfunctional. And if you treat it with whatever ways you can, I treat it holistically, um, which is multiple ways. But you're still, even now, I still have it. And I've been treating it for a couple years now with meds, herbs, acupuncture, and other things like diet, lots of things, therapy. I mean, everything. And so I do everything because for me, if I do not, I am so, so bad. And that's the thing. I just, like I said, I understand other people like have different symptoms, but I think we're all in the same agreement that like this is intense and that it's a different experience than PMS. It's just like, someone said it takes over you, and that's what I feel like. It feels like I just can't think myself anymore. I I I get like into an altered state. I get into different mental states, and it's not like I get into, I mean, it's different. I don't even know how to say it exactly. I guess I'll just talk about, so with me, the major problem is depression and anxiety and suicide risk. So for me, I have other symptoms. One of the main ones is just like mood swings, in that I don't get a lot of anger, but I get frustrated some, but and like irritable, but mostly I get just so depressed, like beyond. I don't even know how to handle it. I don't know how to describe it. It's kind of this like it's this sinking depression every month, and it's totally on point with my cycle. Like, you can I just plan out my calendar and look at my cycle, and I go, okay, here's 2 weeks before my period. That's when it could start. I plan that after that, I know at any point it could start until I get my period. And most people hate getting their period. I can't wait to get my period, because like if it's late, that means just more days of PMDD. Like, oh God, it's just awful. And if it goes on and I'm kind of like hoping it'll just come, I mean, oh, it's so bad when that happens. If it's short though, then you have more often that you have PMDD. So there's no good answer, but I do treat it now, and that has really helped my symptoms. And so, I mean, really what you get at is, there's no good treatment for this. There's no good treatment in terms of treating PMDD, because we don't really understand it as in the medical community. Like, we don't really know what is going on, except that it's hormone fluctuations in some way. And some doctors have more information that help with testing your hormone levels. The people I've gone to really say that, it doesn't really help them. That they can diagnose me with PMDD from everything else, and that they don't actually need to check my hormone levels, because, I mean, it's so obvious that I have this cycle that just goes downhill after a couple weeks. And when I treat that, my problems go away. So it is my cycle. So for me, there's multiple treatments, and one of the things that is the biggest problem for me is the depression, and because it's so intense. The reason I say the treatments now, I'm different, because now I don't get suicidal every month. So that's amazing. It used to happen every single month for years. And I don't know how to explain that to anybody, like why every month you go from like being okay, maybe not great, like I was super depressed in that point in my life before I've been treating this at all. I was super depressed in general, and I was having seizures, and I have PTSD and all these other factors. And so like, yes, I have Lyme disease, which increases depression, all these things. However, the problems with PMDD are like clockwork, and I'm realizing that it has more to do with the PMDD with my other illnesses. The PMDD affects them so much that I don't know that it's really the other illnesses. There's no other illnesses causing my PMDD, I don't think. I think the PMDD is like a big problem, and it causes problems for my other illnesses. So, like I said, major depression, severe depression. However, it gets so much worse. Like, whatever level of depression I'm at, it goes down like 50%. Like, it's so awful. And so, I just really think it's important, because for people like, me, who do have depression as the main symptom, and it's depression and anxiety, because it's not just depressed. I don't actually get super lethargic. I don't just want to, I kind of don't want to do anything, but I don't just want to stay in bed. Like, I still do things, but I cannot handle life. Like, I cannot handle emotions. I start crying, like bawling my head off about some simple things and getting super upset. I don't yell. That may have to do with just how I was brought up, where we really did a lot of communication and we didn't yell and all this stuff. And my parents didn't yell and stuff. So I never got that kind of release as something that I did. So for me, if I get frustrated about it and stuff, I just get frustrated, and it increases my anxiety, but I don't tend to get angry. So I do like during my teens, when this all was starting, the main thing is that like my hormones and my seizures are so connected. So my seizures started when I was 12, and basically everyone who I've talked to, doctors and family and stuff, and friends who know about this, have done research that my seizures very well could be mostly from and exacerbated by the PMDD. So I have what's called catamenial epilepsy. So that's when your hormones affect your seizures. So in my case, it's not necessarily causing the seizures. Like, I have epilepsy, but it's the main trigger. So once I take out the other triggers, like I don't eat sugar at all. I don't, so I try to keep my blood sugar level because I have hypoglycemia. So things like that, I try to keep the other factors level. But when it comes to my cycle, boom, I start going downhill. At this point, I have seizures, and it just makes everything even harder and worse, because then I go into sometimes a state of psychosis from the clusters of seizures that happen because of the PMDD. So it gets insane and it gets horrible. And like I'm really clear though that it's not like the seizures just causes the major problems and the depression and stuff. It's the PMDD and the seizures together, because the seizures can cause like just insane problems mentally that a lot of people don't understand. When you have a bunch of them together, and if you have them uncontrolled, it's horrible, and your mind gets so confused and everything is just dysfunctional in that case. So I'm already, when I was having uncontrolled seizures, meaning I was having grand mal or tonic-clonic seizures, as well as what I now know are simple partial seizures, which are partial seizures where I don't actually pass out. So those have been controlled, the grand mal seizures, for like 12 years now. But the partial seizures still happen. So now I don't have as severe of an epilepsy problem with my PMDD. So because I don't have tonic-clonic seizures every month, where I used to have, and I finally figured this out from keeping track of my cycle, was that about once a month I would have a tonic-clonic seizure, and then the rest of the month I wouldn't. And so it was about once a month. So it was almost always, as I figured out, like the week before my period. So my seizures get aggravated, and so when it's like 2 weeks after, I have to start watching out. And so for me, it gets like dangerous, and it gets really scary, because I do go into sometimes like an altered state of too much seizures. And then I also feel very messed up from the PMDD. Like, even if I don't have any seizures, I still have like such a hard time. And like I said, when I do have more seizures, and then when I was having the tonic-clonic seizures, it was so much worse. So now treating everything, treating the epilepsy, I'm on 2 epilepsy meds, treating the depression by itself and the anxiety by itself, because those symptoms, whether they're from the PMDD or whether they are not, and the PMDD is affected by them, I really think the PMDD either causes the depression or like makes the depression so much worse. Because I also have Lyme disease and I also have epilepsy, and those are major factors for depression. So it may be that my depression initially is more from my other illnesses, or just that I have major depression, but it gets so much worse. And my suicide problems come up. So I guess, I don't know what to say except that it's dangerous for me to have PMDD. Like, every month I do everything I can to have like no problems, and I can make it through the month most of the time. But I mean, like the last time that I had a major problem was a year ago, and I lost it. I fell apart, and I was calling the mental health crisis line. Because if I'm alone, I mean, I even have to sometimes, like, my girlfriend works nights, and if she's gonna be gone and I know it's PMDD week, I sometimes go over to other people's houses and spend the night, because it is too bad for me to be at home alone, because everything gets worse when I'm alone, because I have PTSD and I just get more anxious and more depressed. So, I mean, and I don't function as well, and then I don't eat as well, and then everything goes downhill when you exacerbate any of this stuff. So, the PMDD just goes like that. I mean, my life, everything goes downhill. I can't work easily. I can't deal with people and life. And so the main thing for me, somebody said it feels like the monthly enemy or a monster, or for me it's like a fog. Like, it starts coming along and I kind of sort of notice it because I have it on my calendar, like it's PMDD weeks. So after 2 weeks, it's a warning on my calendar, like now it can happen anytime. And so then usually at least 10 days, always a week, between a week and 2 weeks is how much I have PMDD. So always the week before. So I call that PMDD week, but it can be before that. And so then I just say, okay, darling, my girlfriend, it's PMDD. Like, and we just kind of let some things go about what I'm upset about, like the content, because it doesn't really matter. When I'm crying because of, and super upset, like hurt and all this stuff about something so simple, like can't even think of an example, but just things that don't really warrant getting super upset and crying. Like, it just doesn't, you don't need to be that upset about some of these things. And so when I get like that, I'll start crying, and then I'm like, oh, this is the PMDD crying. Like, it's a different thing. It's where I get weepy. So little things cause me to cry. Especially once I get close to my period. So the crying happens, the depression starts, the feeling totally, like the anxiety that I get is different too. But the thing that I can't even just explain exactly is this slow progression down to a state of confusion and depression and anxiety, and problem for me that it gets dangerous. So I've had problems with cutting. I've had problems with major suicidal ideation, meaning where you're thinking about it and wanting to, or coming up with plans, or whatever it is. That usually it's just that you get these feelings that you want to do something, or you think about doing something a lot, or not even a lot, but just that you think about that every day of wanting to die and wanting to kill yourself. And I know this is hard for people to talk about because suicidal problems are like really scary, because I'm actually pretty safe now. Like, I have support now, I have medicine now, I have a therapist who I call during PMDD week a lot of the time, because I get to a state. This last month I got into an altered state. Like, I even said to my girlfriend, I'm like, I am in some kind of like PMDD state. Like, I don't even know how to describe it sometimes, but it's like once I notice it, and like I said, I have it on my calendar as a warning, and then I start noticing it, like the anxiety comes up, and the anxiety is about whatever. Like, it's not even about something that I'm really anxious about, like that gets worse. So whatever I'm worried about and all that, that gets way worse. But it also brings on this anxiety of, like, I was sitting at the doctor's office going to my foot doctor, and I was just like, couldn't breathe fully. Like, I'm like, why am I so anxious? I mean, yes, I don't like going to the foot doctor, and he gave me a shot in my foot one time and it caused a reaction. It was awful. But I don't think it's just that, like other times I've been able to go and I didn't have major anxiety. And then it was right before my period and I had major anxiety. And so it's like, but now it's like, what, 5 or 6 days after I started my period. So now I'm okay. And I feel like I go downhill. I get to this point where I get depressed. Then I get anxious, or the anxiety comes first. And then I start having seizures. And then, or even if I don't, I get to this state of like the fog. Like, I can't see outside it. Like, I can't think normally. Like, I can't just say, okay, you know what? This is just not a big deal. Like, I think I'll just, I can't even like get up and go make myself food necessarily, because I just can't deal with the normal things in life. And my Lyme seems to get worse, and that has to do with a lot of things, like your temperature changing and stuff like that. But a lot of times it gets worse, so then my fatigue gets worse. Or maybe it's just the PMDD and fatigue, and then you add it on to my Lyme fatigue, and then it gets really bad. But, it starts being hard for me to make sure I eat, and it's hard, like, to just go anywhere. And I don't want to talk to people. Like, I find a lot of people say, that they want to be alone. Well, I find that I don't really want to be alone, but I have trouble, like, I don't want to talk to people who don't understand that I'm having PMDD. Like, I don't want to just try to call up a friend, who I haven't talked to in a while. Like, I'm not going to call them during PMDD week. I'm going to call them later. Like, and if somebody calls, I have trouble picking up the phone, it's like, I'm in an altered state, and I just can't deal with talking to people and trying to like have a regular conversation, because I'm just like out there somewhere in this state. And it feels like literally as I come out of it, once I get my period, I start coming out of it, I start to get a little happier, and then I start to just relax a little, and then things start to get a little better. And it's just kind of like I come out of this, I wake up again. It's almost like an awakening of like, now I can see clearly. Now I can think clearly. Now the world is okay. I think that's really rough to go downhill like this every month.